When it comes to reproductive health care, oftentimes the diagnoses of things that could be going on, whether it's polycystic ovary syndrome, fibroids, endometriosis, infertility, all of these diagnoses are often delayed by years. Sometimes it takes a long time to figure out that there could be something going on with your reproductive health care, and we miss signs along the way. When it comes to lifestyle, there is a lot that we can actually be doing to be preventative and taking care of our reproductive health, to be learning more about periods, fertility, building family on your own time, and learning to manage all of the symptoms of a healthy menstrual cycle. Whether it's diet, figuring out what's right for your body, getting the right type of physical exercise for you, maintaining social connectedness, and learning how to build a support network and cultivate a community around you, getting restorative sleep, and other aspects of lifestyle medicine, there is so much we can do to help protect our reproductive health along the way. This can reduce the chances of complications from diagnoses we may not even know we have that have been undiagnosed or are lurking, and help us get healthy outcomes when we're ready, whether that comes to building families or supporting those around you that are your loved ones that want to do so. Come join to learn more about lifestyle medicine and fertility.